Well, welcome to the Digital Handshake podcast. I'm your host, Scott Jorgensen, and we want to thank our sponsors here at Media PSC for making this podcast available. Well, tonight we're joined by a special guest, Dr. Shawna Kleban from Charlotte, North Carolina. So happy to have you on the podcast tonight.
Thanks so much for having me. It's a pleasure.
We'd like to learn a little bit about you. So I understand that you're in Charlotte, North Carolina, and you're with the HKB group, which is obviously a very well-renowned plastic surgery group there in the Carolinas. Well, first off, how did that come about?
So I actually started my journey with HKB as a fellow. So there's an aesthetic plastic surgery fellowship here at HKB. And so I actually joined on after being their fellow for a year, which I was very lucky to do at their kind of flagship location in Charlotte, North Carolina. We now have, I think it's up to 11 different practices across the Southeast. And so just keeps growing every day.
Okay.
When I joined, it was, I think, 2 practices. So it's definitely exploded from there. And it's been an honor to continue to work there. And I've actually had the pleasure of becoming fellowship director as well. So getting to, train the future generation of surgeons as well.
Within plastic surgery, what's kind of your focal point? I mean, is there a particular procedure or a group of procedures or part of the body that's kind of like that's your go-to?
I've really focused my practice on massive weight loss body contouring. And so it's really a super rewarding thing that I get to do. And we've seen such a boom in weight loss with these GLP-1s, Ozempic, Zepbound, all those different medications. And it was always something that I enjoyed. And so it's great that there's even more patients that we get to take care of and help. I also do a lot of breast and body in general. I kind of focus more on there, and then a little bit of face here and there just to mix things up.
Well, let's talk a little bit about the massive weight loss patient, because it is becoming kind of an interesting group of patients that are now presenting themselves at plastic surgery practices. I mean, I'll give you an example. We just watched the Grammys, and I think we're all sort of like blown away by like Jelly Roll. And what is it, like a 200-pound or even perhaps 300-pound weight loss transformation? Pretty remarkable. I mean, he looks amazing. But, talk to me like a patient like Jelly Roll. I got to imagine there's a lot of loose skin and laxity and all that he's probably going to have to manage through.
Oh, yeah. I mean, weight loss affects pretty much head to toe. And it's fascinating how, one patient to the next, they'll present so differently. So they'll come in, one patient will have most of the excess skin maybe in their trunk, the other mostly in their thighs. And so it's a really individualized type of surgery because patients present so differently. And it's a longitudinal care of these patients because they often need multiple surgeries.
Right.
That you get to see these big transformations and really help them address everything that's of concern for them. So I'm sure Jelly Roll, he may have the same number of rolls, but they're thinned out.
It's funny. Is he going to keep the name Jelly Roll? I mean, I got to imagine he will, right? I mean, he's lost all this weight. Now he's like super fit, but like, does the name still apply? I don't know.
I wouldn't change it. I think it's a great name.
It is a great name. And who doesn't love a Jelly Roll? I mean, come on.
Exactly.
So, thinking about these patients, how do they come to find you, right? So one of the things we focus on here at the Digital Handshake is how do we make your, first digital impression your strongest asset and create that sort of warm handshake with patients? What are you doing in the, North Carolina, Charlotte community to get the word out that, hey, you're the go-to when it comes to massive weight loss patients, when it comes to plastic surgery?
So there's a couple different things that I've done. One of them is being involved with the weight loss support groups.
Yeah.
And so there's a university hospital-based system out here in Charlotte that I partner with and give talks about massive weight loss and skin removal surgery. And so I give that talk to them every year, sometimes twice a year. And it really just helps to educate patients. And then they know that I'm kind of a resource. If they are interested in that type of surgery, I show them, what's possible, show them some before and afters, and educate them about what downtime recovery looks like and when the right time is to look for your surgeon. And then I've also been working with some other physicians in the area who specialize in weight loss, and being on a podcast with them also helps too. So reaching patients who are in their weight loss journey, depending on what point in time, every touch point makes a big difference to get them to the right person to have the procedure that's right for them.
You mentioned podcasting. We have noticed that plastic surgeons that are making that investment in their own digital marketing through podcasting are really seeing a big return from that investment because patients are truly looking for that more long form content, especially around particular procedures where, they've been thinking about it for some time. It's perhaps, a large financial investment on their part, and as much information as they can get their hands on, they're consuming, right? So podcasting has definitely lent to that sort of platform and format. And so we're really happy to have you on tonight to talk more about this particular issue because I think it's, really, really an important topic within plastic surgery. Let's switch gears a little bit. I mean, let's talk a little bit about, other procedures that you perform in the practice and sort of how you're marketing those. I got to imagine, with a large group practice like HKB, like social media is super, super important, right? When it comes to trying to, capture those patients that are higher up in the funnel and, just doing whatever you can to make them aware of, all the great things that you guys are doing. Can you speak a little bit about kind of all the great social media stuff that you guys are doing there at HKB?
Yeah, so I think there's a lot of options out there, right? So there's a lot of different platforms that you can choose to be a part of, that you can focus on. You can cast a wide net, you can be more narrow. I think a lot of our focus has been on Instagram. That tends to be our patient population age range. And then also using things like YouTube for longer format, TikTok even. TikTok's a little tricky. But using those different avenues to reach different patient populations. And I think that's kind of what, when you're putting things together, is how do you figure out how to get things seen? And figuring out who that patient population is really helps you focus in on what type of content is going to connect best with those patients. I think far and wide, creating content that's true and authentic is key. And, that's one of the number one things that I think kind of brings patients in the door is if they think they know you a little bit before they meet you, that's huge because you've already sold the biggest part, right? You. And then it's all the other things of what you have to offer as a practice and a surgical facility and follow-ups and all this other care. But figuring out how to portray you and your own authentic self in a digital format is kind of the key to successful marketing, in my opinion.
So when the marketing team has come to you and says, okay, Shawna, it's time for you to do a post. We need to put a social media post out there, promoting you and how amazing you are. Is there one that comes to mind where you're like, oh, that was super fun, or that went like totally viral, wasn't expecting that?
I think I have a little bit more of a sense of humor. I like things that are a little bit lighter. I love to educate, but I like it balanced with my personality of having a little bit more fun. And, when I was in training and a young plastic surgeon, I looked up to these very polished plastic surgeons that were very New York, Park Avenue, all of those sorts of things. And that's not me. And I can't fit into that box. And so anything that I tried to do to fit into that box of this super polished person, it just wasn't going to be it. So like today, I'm wearing scrubs and glasses, but you might see me in my scrub cap and no makeup on, but you might also see me fully glammed up. So it's really figuring out how to portray that version of you to create those connections that is so important. So anything where I get to have a little fun, be lighthearted, that's where I've seen kind of the most success.
Let's talk about your patients. So I understand that you did training in Vegas and you're now practicing in the East Coast, right? North Carolina.
Yes.
The patients that you're seeing in your practice today, how has that changed? How has that evolved? Whether geographically, kind of what their needs and interess, and then just, overall kind of what's surprising you when patients come in and are visiting with you each day? What's some of the things you're kind of like, oh, wow, I wasn't expecting that?
I love practicing in the Carolinas. I think it's such a wonderful place to practice because you have such a diverse patient population. In Vegas, it was very trauma heavy at the time I was in training, but it's just a different patient population. I've trained East Coast, West Coast, all over the place. So I can adapt to kind of wherever I am. But I will say the patients from the Carolinas are some of the kindest, sweetest people. I can't forget my Tennessee patients and my West Virginia and my Virginia patients that all come to me as well. But this area just brings kind of this such like a genuine, kind type of person, and those are the people that, not that I'm surprised to have as part of my practice, but I'm just very grateful to have as part of my practice. And I think one of the things that I was shocked about is patients coming to me because they want the real truth. They don't want it sugar coated. They don't want, you know, they don't want to have the wool pulled over their eyes. They want to know what's going to happen and what it's really going to feel like. And I've kind of become known for that in our practice. And so when patients want the real deal, they'll come to me. You can sell yourself, sell surgery in whatever sort of way you want. But for me, I want to sell the truth. I want to tell them exactly how it's going to be as much as possible.
Well, that's good to know that if I'm coming to Dr. Shawna, I'm going to get, no beating around the bush.
Yep.
You're going to hit me straight between the eyeballs. I like that. One of the things I find really interesting about your career path and kind of where you're at is your decision to, join a large group practice like HKB. Let's kind of focus to perhaps young surgeons that are, whether in residency or fellowship, or considering, okay, where do I go in my next step? I'm sure you're really happy with your decision, but, now where you're at now, would you have done anything differently?
All of our decisions, all of the chances that we have in our life, we always look back and say, oh, could I have done this a little bit differently? But the more that I look back on it over the last 5-6 years, the happier I am with my decision. I've been able to have opportunities I would never be able to have as a solo practitioner. I mean, getting to, visit different surgeons across the country, or visit, implant manufacturers, being able to speak at the upcoming aesthetic surgery meeting. Like, I wouldn't have those opportunities had I been a solo practitioner. And the collegiality and friendliness and just willingness to help each other out is something that I really looked for as well. And so I'm lucky that if I have a case that I've kind of scratched my head about time and time again, I can turn to one of 5 different surgeons easily and get some help without judgment, without fear of them thinking that I'm an idiot. So it's nice to have that safety net. I don't use it much. I feel good about what I provide to patients, but in those moments, it's really nice to be able to turn to somebody else and have a friend there, truly. And as we grow as a practice, it just has given me even more opportunities and more different perspectives from different surgeons. So we're able to collaborate and really create this almost brain trust of HKB to be able to provide the best care for our patients. And it's really special. We actually meet like monthly and kind of talk about things and share any new things that we've come up with. Questions about technique or anything are totally fine to ask as part of that group meeting as well. And so it's great. It's gone from, this setting of 6 surgeons to now, I don't even know how many surgeons we have. I've lost count. It may change tomorrow. But they're leaders in the field. And so being able to have mentors across different states too is really special as well.
Well, I know many of the principals and leaders there and surgeons at HKB, and you're with some of the world's best. So it's an extremely impressive group, and I'm really happy for you. I think to wrap up, let's talk a little bit about breast augmentation. There's been a lot of talk about just kind of, different celebrities that have been considering whether getting implants or having their implants removed, right, is also another important topic. But I think, one of the things that's interesting is when you talk to patients and they're deciding, okay, like, what do I want my breasts to look like post-procedure? A lot of times they'll like bring in pictures of different celebrities. Do you have patients that do this?
It was Kylie Jenner for a while,
Kylie
right?
Jenner.
When she, came out with her implant size and details about her surgery. But yeah, of course they do. And I kind of encourage it because a patient will come in, say, I want a natural result. I want this. And then they show you a patient who clearly has very round, high sitting, her implants are sitting high, a lot of upper pole fullness.
Right.
And you have to change the conversation. Then you say, okay, well, this doesn't look so natural. Is that okay with you? Is this more of what you're thinking? Because that's fine. But natural to one person versus another is so incredibly different. And so, I've been burned in the past before when a patient says, I want a very natural look, very modest. I don't want a lot of roundness up top. So we go with a softer implant, and they try on sizers, and they're like, I missed right after surgery when it was sitting high. And so those are hard discussions to have, but also for those patients, you don't know what you don't know.
Well, what about that patient that comes in and she brings that picture of Sydney Sweeney and you're like, sweetheart, you're not going to be Sydney Sweeney. I mean, how do you manage that?
We talk a lot about finding pictures of patients that start off looking like you and end up where you want to be.
Okay.
Because what you start with has a big impact on where you end up. And so, of course, everybody wants to look like a Sydney Sweeney with a waist of like 22 inches and, nice natural breasts. But that's not the same journey for everybody. If they are, have a BMI of 41,
right,
they're going to start off in a different place. And so we can get a great result. It's just going to be different than maybe what they expect.
My final question is, when it comes to your own marketing, right? I know you do a lot of sort of what I'll call more corporate marketing with under the HKB umbrella, but I can imagine that you're also trying to stand out on your own and try to identify, create your own identity, right? Even within HKB. What are you doing in that aspect to, really differentiate yourself and stand out in that sort of, very competitive North Carolina market?
With that is creating just new opportunities all the time for myself. And so saying yes to everything, like this podcast, doing that, working with industry sponsors to create events that patients can come to where I can show who I am and what I have to offer, I think can be really beneficial. In addition, just reposting the content that I feel is the most authentic to me and being kind of hammering that home over and over and over again, not getting caught up in the competition of how many followers I have one day versus somebody else, because truly it's not necessarily how many people are following you. It's about how many of those people end up coming to you for surgery.
Yeah.
So you could have, 2 million followers. If only 100 come for surgery, it doesn't matter at the end of the day.
Well, I want to say a big thank you for coming on the podcast tonight. You've been an amazing guest and your insights are tremendous. And obviously you're very, very smart and very, very talented. And, we're very happy to have you on the podcast tonight.
Yeah. Thank you so much.
And again, thank you to our sponsors, Media PSC, for making this podcast available. And we look forward to having all of our, great audience on our next episode. Thanks, Shawna.